Well, tomorrow the world will observe World Brain Day. The annual event, marked on the 22nd of July, aims to raise awareness of the importance of brain health. Instituted by the World Federation of Neurology in 1957, the goal is to promote neurological education and training worldwide and to foster neurological health. Dr. James Butler is the neurologist and executive board member of the Neurological Association of South Africa, and he joins us now to just unpack this a little bit further on. Thank you so much for your time this afternoon. So, I mean, when you start listening to brain health, it really becomes more important, and we want to understand what it entails exactly. I mean, in recent years, especially following COVID-19, we've been warned that mental health is, likely to be the next global pandemic. So with those odds, how then does one go about ensuring brain health?
Well, I think that's an excellent question. And I often say to people, especially young people, that of everything you've ever owned, that you own or will own in your life, by far your greatest asset is your brain. And hence one has to look after it. And in looking after it, and that's each one of us, we have to nourish it, we have to do what's physiologically good for it, and we have to protect it. And so all sorts of things threaten our brain health, from our environment, head injuries, our diet, how we sleep at night, how we exercise, all of those things. And we know that although those sound very basic, they're very important for brain health. So it's essentially going about looking after your own brain. We know that alcohol is bad for the brain, especially long term. We know that smoking is bad for the brain, especially long term. So one needs to think about these things very, very carefully at an individual level. And mostly it's about educating people. So once brain diseases are established after many years of poor lifestyle choices, that you live with the consequences. So the idea is to start early and to prevent trouble, preventative medicine rather than curative medicine.
Yeah. And I mean, just in terms of, just on the preventative side of things, we've been told what to look out for instance, when one has a stroke, as an example. What are the notable signs that you have a brain disorder, and how should you act immediately when you get some of those signs?
Yeah, that's an excellent question. So we now have interventions which, if provided very quickly after the onset of the stroke, can dramatically change the outcomes. And sometimes people are back to normal. When clots develop in the arteries to the brain, one can rapidly remove them. And so the way strokes present are sudden losses of neurological function. There might be paralysis down one side of the body. There might be loss of vision down one side, on one side of your visual field. There might be loss of sensation. There might be loss of speech. So anything that presents abruptly, acutely meaning suddenly, and involves brain function, one needs to get help quickly.
And maybe on that point, in terms of brain disorders, what are the trends telling you, in terms of advancements, particularly in neurology, just to prevent some of these signals that we're talking about, but also just the advancements that have been made in neurology in terms of the impact, that these diagnoses and disorders have on the brain?
Yeah, that's an excellent question. It's a long story, but in simple terms, in the 1990s, America declared that the decade of the brain. And if you go back to the 1980s and 1990s, our treatments for various neurological conditions were primitive when compared to today's treatments. And so we in all spheres of neurology, pretty well, with some exceptions, we've made substantial advances at the minimum in understanding it, but particularly in treating common conditions and common diseases, migraine, stroke, epilepsy. Those are all very common in the general population. And what we're able to offer people today is hugely better than it was, say, 20 years ago.
And, we started off our conversation by just talking about mental health. I mean, we know that, of course, thousands, if not millions of people are battling mental health issues on a daily basis. How does brain disorder, or brain disorders, how do they translate to mental health disorders specifically?
Yeah, this is a question of the brain and the mind. And, in very simple terms, all of our emotions, all of our feelings, all of our behavior, all of our functions really are seated in the brain. And so while we all are endowed with various genes that determine or partly determine those, our environment is equally important. So the way you sleep, the way you exercise, the way you interact with others, the way you socialize, the way you drink, those things all affect or may affect brain health, and particularly mental health. So we as both across neurologists, the fields of neurological sciences, which includes neurology and psychiatry, we're particularly interested in brain health and promoting that. And we know that there's good scientific evidence that attention to those fosters improved outcomes when it comes to brain health. And then it's a question of access to resources, so access to medical care. It's a problem in this country, as you know, and people who are privileged to have direct access to those is something to cherish and something to use, not abuse, to use it. And that leads to better outcomes.
It is a challenge, Dr. Butler. I do agree with you, especially when you look at some of the advice that you get from, experts such as yourselves in terms of breathing clean air. Sometimes these are outside of your control. And there's also, of course, prioritizing sleep. As you know, some people also are working long hours in this country, but it is something that is important. But thank you so much for your time. That's all we have time for, unfortunately. Dr. James Butler, of course, is a neurologist. Tomorrow, the world will observe World Brain Day. By any means necessary, protect your brain.